Welcome applicants. This is Dr. Worcester from the University of South Alabama Department of Occupational Therapy. Welcome to our gorgeous brand spanking new relatively building. It's a very pretty facility with a lot of modern amenities built into it. And when you come for your interviews or come for a tour when we're allowed to do that, you will enter through the big glass doors. This is actually 2 stories of doors. The other entrance has speech and audiology listed on it. This is the entrance that you come in to visit the Occupational Therapy Department. So we welcome your interest and we hope that you'll love the tour that we're about to provide for you. So come on in. Okay, so welcome to our one of our many lab spaces, and this is used primarily for some of our pediatric labs. As you can see over here, we have all the equipment that you would standardly find in occupational therapy rehab gym type space for our children. So we have equipment that we pull out for certain labs. We have mat tables. We also have mats that we can actually put down on the floor, which we do a lot in pediatrics. And our cabinets have a variety of toys that we pull out, so our students get to practice some actual therapy interventions when we pull out the right types of equipment and toys, and we use a variety of dolls sometimes as some of our participant subjects to pretend with. And this room allows us to have a wide open space to work with. We also can use it for small group activities, so this is one of our many rooms. All right, so come on in and I'll show you one of our typical classrooms. So we have our classroom set up. Right now you'll see X marks the spot. During COVID-19 and the pandemic, we will be making our students sit 6 feet apart from each other and wearing masks in the classroom, but hopefully we won't have to do that for too much longer. This is more like you would probably think of as a standard classroom. We do have the full projection system and the interactive whiteboard for us and our computer set up. Our students do have some tables that allow them to plug in their computers during class. This room also has a variety of assessment tools stored in the back cabinets. And it's probably one of the more traditional rooms that we have here in the Occupational Therapy Department. So welcome to our ADL room, as we call it. You'll see that this room is set up more like a standard rehabilitation gym on this side of the room, where we have our high mat tables and our low mat tables. We have enough space here to conduct some of our lab sections. We do have a high load table. We also have another big component over here, which we'll take you into in just a minute. We have set up in this room both a kitchen, a bathroom, and a mock hospital room, and then we have our wheelchairs that we use for many of our lab activities for experiential learning with our students. So now we'll take you into the bedroom. So this is our small bedroom. That's for us to practice like it would possibly be really in the hospital. We have a hospital bed, we have a Hoyer lift, We have a variety of mobility equipment, and so we will have a variety of practice sessions with our students in here. We do have a simulation lab here at the university where we have a large room with multiple beds that we actually can take our students to practice in as well. This is a good, they can practice anytime kind of room, or one-to-one practice session in here. And this is our rehab bathroom. So you'll see a variety of pieces of equipment here. We will work with our students to understand all of these different pieces of equipment, when you might select which ones for a variety of patients, how to set them up, and also transfers and doing your ADL skills. So we have a working shower, we have a working bathtub, and right now we have a transfer tub bench there, as well as a variety of raised toilet seats and commodes with different types of arms and a different adjustability. So our students get to actually practice setting up the equipment and doing transfers and ADLs with the equipment. Okay, so welcome to our ADL Kitchen. It's small intentionally because this is probably the average size of many of the kitchens in some of our folks' apartments and homes. So we chose not to make it wheelchair accessible. We chose to keep it a little small, and that is more realistic for us to practice mobility, functional mobility training, and then different techniques in the kitchen. So if we need to practice with a patient safety techniques, how to do things one-handed, if we needed to label things in the kitchen for memory. This is a functioning kitchen, everything works. Our students get to practice with a variety of clients, including our standardized patients who come in and act like our patients, and teach them whether they're sitting in a wheelchair or using a walker or using a cane, and then the variety of strategies for low vision, cognitive impairments, and motor impairments and sensory impairments that we might experience with a variety of our clients. Hello applicants, welcome to another one of our occupational therapy classrooms. This is set up like a more traditional classroom. We have our projection system, we have our interactive whiteboard so that we can be doing our lecture components. But this room also has some additional features in it. This is one of the rooms that we use for our hand courses and particularly our splinting. It has extra plugs in the floor that help us with being able to do our splinting in here. And our students will learn to make customized hand splints, and there's a variety of different styles and types of hand splints. Finger splints, wrist splints, resting hand splints that they will practice making, and over a series of practice sessions will get better at making their hand splints before they arrive on their clinical rotations.